do like a little 1-day thing on ADD at some point. There's not really like a easy answer for that.
All right, I think we're ready for the next one.
Okay, so let's jump into a protocol. Okay, so this is kind of the tail end of that lymphatic and advanced stress treatment. And this is starting to help to change your response to stress. And so here, this first piece, we have emotional release. And we're going to need some substitutes. So give me a minute and I'll come up with your substitutes here. So these would be choices: larch, rose, poplar balsam, tuberose, Karo, K-A-R-O, St. John's wort, helichrysum, basil, and that's any basil.
What was after Karo?
St. John's wort. And also saffron. So just right there, how are we with everybody? Are we needing other substitutes?
Type in if you need a substitute. One person asked marjoram, another asked from the Vital Centers class, anything. So no for those. Let me know if you need a substitute. You can list your other oils as needed. If you've emailed me your list of oils, you can let me know that and I can look it up. We are, it wasn't in the manual yet.
Yeah, it wasn't in the manual.
So it was like the last part that Greg didn't get to. And since we didn't do the manual till after the class was done, we'll still get this over to you guys. And go ahead and get started and I'll see about.
Okay. So no need to think about anything or visualize anything. We'll just start this process and we'll see how it goes. Okay, so begin inhaling. Your awareness is on the heart, the center of your chest. She's right. Keep inhaling. Your awareness is on the front heart. Move your awareness to the back heart. Your awareness is on the back heart. Taking long, slow Deep breaths. Your awareness is on the crown, the top of your head. Move your awareness to the solar plexus below your ribs on your upper abdomen. Your back solar plexus, the middle of your back. Your throat. The back of your throat, the middle of the back of your neck. The back head, opposite your eyebrows on the back side. The area between your eyebrows, the ajna. The bottom of your tailbone, the basic chakra. The soles of your feet. Just be still, be aware. Notice how you feel, your body, your emotions, your mind. We're going to do the same application again. Same oil, same everything. Begin inhaling. Your awareness is on your heart. Your awareness is on your back part, the area between your shoulder blades. Move your awareness to the crown. Move your awareness to the solar plexus, the area below your ribs on your upper abdomen. Move your awareness to the back solar plexus, the middle of your back. Move your awareness to your throat. Move your awareness to your back throat, the middle of the back of your neck. To your back head, opposite your eyebrows. The area between your eyebrows, the ajna. Your awareness is between the eyebrows. The bottom of the tailbone, the basic chakra. The soles of your feet. Just be still, be aware, and let go. Begin inhaling again, this time on your forehead. Go to the bottom of your tailbone. Your hips. Your knees, the front and back knees. The ankles. The soles of your feet. The armpits. Long, slow, deep breath with your awareness on the armpits. Your awareness is on the elbows. Long, slow, deep breath with your awareness on the elbows. Your wrists. the palms of your hands. The front heart, the center of your chest. And your back heart, the middle of your upper back, the area between your shoulder blades. Just be still, be aware, keep your eyes closed, just let go. Maintain your stillness and awareness. Begin inhaling again. Same application, same oil. Your awareness is on your forehead. Move your awareness to the bottom of your tailbone, the basic chakra. Your hips. Your knees, front and back knees. your ankles, your awareness is on your ankles, the soles of your feet. Your armpits, you're still on your armpits, taking long, slow, deep breaths. Move to the elbows. Your wrists, the palms of your hands, your awareness is on the palms of your hands. Move your awareness to the front heart. Move your awareness to the back heart. And this is on the back heart. Just be still, be aware, and let go. Pay attention to your body, your emotions, your mind, your thoughts. Okay, let's see how you feel. Now, there's 2 more applications. We're not, obviously not going to get them in by the end of the night, but we'll do them over the next week or so. Next Tuesday night, we should be able to fit the other 2 in. But let's just see how you feel with what we've done.
Hi, Greg. It's Leslie.
Hey, Leslie.
I wanted to let you know that I was the person during the lymphatic class that said that I have lymphedema. And I wanted to
Okay.
let you know that what we did, it jumpstart something for me, and
Yeah,
it
yeah,
changed
yeah,
something a
should,
lot.
yeah.
There was a lot of pain that I was having in the body, and there was pockets of fluid and stuff that was being built up around the knees. A lot of fluid is gone behind the knee. The
Yeah.
legs within 1 day started to come down. I noticed
Yeah.
within it lasted for about 3 days without taking anything internally. So I know it's something I have to keep repeating. At the
Yeah.
same time, whatever else I added to it, it complemented and it allowed
Yeah.
it to work better. I had a hard time for about 2 years drinking fluid, and I wouldn't drink fluid for anything. It allowed me also to start taking in more fluid.
Yeah, see it's a very interesting thing, and it took me a lot of years to really understand that. But like a lot of times, what happens is we'll take in fluid, and instead of processing it properly, your body just keeps kicking it off into the tissue, and so there's blockages in like the lymphatic system, and potentially even in the veins. You know, return blood to the heart. Could be. Could be also in the urinary tract itself. And when we go through and we do the stuff that we did, you know, it really unwinds those blockages, and you're able to take in more fluid, and you're eliminating more. And so, you know, you're flushing out the fluid that's been, you know, that you've been holding on to, the body's been holding on to, you know, the retention. You start losing that, but like you said, like more starts to move, like places where it's built up starts to move, and you're able to take in more fluid, and it's not kicking it off into the tissues. And really, you could take it a step further and say, it's almost important to take on more fluid because you're having a greater flushing effect. And so it will really change like areas in your body where there's achiness, where there was fluid retention, where, you know, especially in the lower limbs and things, but even like back issues and things, you know, it changes it. And it doesn't mean that you have to do it all the time. A lot of times you just kind of have to jumpstart it, and then you can keep taking on like more fluid, and it keeps flushing it out of your system. And it really improves the quality of life because the body starts functioning better and feeling better. You know, the one thing that I can't remember if I said it or not, but when you really started increasing fluids quite a bit, you know, just some sort of like electrolyte replacement, or like I usually like take like a multi-mineral or that stuff, cell food, that's the water-based, you know, minerals. And just to make sure that you're moving so much fluid and you're releasing so much fluid, I just want to make sure that you maintain like mineral balance.
Okay. It's been,
Yeah.
it definitely gave me more energy on
It
my
can be,
legs.
it can be life-changing,
Yeah,
honestly.
it was.
It can
I
be
wasn't
totally
able,
life-changing.
I wasn't able to walk for a while because of how much it hurted. I have
Mhm.
more energy in my legs. I'm able to walk. I also wanted to let you know that they're using now the lymphatic system to treat for COVID. There's a video. It's called by a
Oh,
young
it's not surprising. Yeah, it's not
her name,
surprising.
her
Yeah.
name is Cancer Rehab Patient. And it came out today. And the name of the video says how to do lymphatic drainage massages to help recover for for COVID-19.
Hmm.
So if you want to watch it, maybe
So,
there's
so
something.
it's helping with like the reduction of the post-infection symptoms, or like getting over the symptoms and the infection itself.
I think a little bit of both, and the
A little
doctors
bit
are
of both.
starting to use it. So I was wondering if you
Yeah.
watch the video, if you could come up with something that we can
Yeah.
do
Sure.
energetically to,
Sure.
yeah. And like I said, I want to let you know that these classes that I've been taking have helped me a lot. A lot of the brain classes, out of nowhere, I'm starting to pick up, like, words just come in, and I'm
Yeah.
starting to use
Good.
words that I've never used before. And
Right.
it's more like I feel smarter, and this feels
Yeah.
like,
Yeah.
yeah. And
Yeah. I'm laughing because I was like, good for you. Yeah, that's exactly what starts to happen.
And
Yeah.
also I live in the Bronx. I'm from the Bronx, and my I work at a city hospital, and it's very hostile here. But whatever protocols I'm doing, I've been around a lot of COVID patients and people. I've been okay, and I'm not
Yeah.
vaccinated. I kind of don't want to do the vaccine thing right now. I'm like you. I'm just holding off on that.
Yeah. It's one of those things where I mean, it's such uncharted areas. Like it's just, it's hard to make a good choice right now. And it's not solid ground on what you can make as a good choice or a bad choice. It's really an odd time.
Yeah, definitely.
Yeah.
But I wanted to say once again, thank you very much. I have a few people that might be reaching out to you
Okay.
for healing. I hope that's okay if I share
Sure.
your email.
Sure.
And, just wanted to say thank you and that it's
You're
working.
so welcome. I'm glad the lymphatics, the other byproduct to doing the lymphatic stuff on the weekend that we did is usually there's a little bit of weight loss too.
Yeah,
Because
I'm
you're
healthy too.
holding on to the fluid, and part of that is, it eventually turns to like mucus, and it turns to all kinds of things, and it slows down processes in the body. You start moving everything, and all of a sudden, your appetite changes, for one, and two, you start shedding a little bit of weight. And the issue, I think, is not so much sometimes people's issues with food. It might be issues with water. The taking in more fluid definitely changes your appetite to where you don't crave the things that you normally crave. And the lymphatic system, we joke around here as, like, anybody asks me anything, I just go lymphatic system, lymphatic system, lymphatic system. It's so impactful on so many levels, on so many things, that it's just, we'd kind of dabbled with it in some of the other classes, but we can still even add to what we did over the weekend. But I mean, I think that was a good chunk of, like, you just want to generally just flush out the lymphatic system. That is a great way to go through and do
Yeah,
it.
I agree.
Yeah.
It definitely did. It did a lot for me. It definitely
Yeah.
helped. And then I started changing the eating, because your eating also affects it also.
Yeah.
So whatever I started doing after, and it just worked. Like everything just
Yeah.
started working, and I came down about 8 pounds. So I
Yeah.
was like, good. And I just keep going. I wasn't even going to the bathroom, and I was starting to develop a lot of UTIs.
Yes,
Um,
exactly.
and
Exactly.
I was like,
Yeah.
okay, I feel better because I feel like I'm releasing more. I'm going to the bathroom more. Like I have a less chance of getting another UTI.
Yeah.
Yeah, definitely. Once
Yeah.
again, thank you so much.
You're so welcome. You're so welcome. Glad you're feeling better. Keep us posted, okay?
I will.
Go ahead, Barbara.
Hey, Miss Barbara.
Hey there. I feel like my nervous system might have gone into hyperdrive a little bit.
Like you got agitated or stirred up?
Stirred up. Initially, it
Stirred up?
felt like prickly all down my spine and in the joints of my arms and legs. And that quieted down towards the end. And now it just feels like it's moving fast and maybe flushing things. I don't really know, but it,
Yeah, it's a way to, you're flushing things and it's impacting the fight flight system in your autonomic nervous system.
definitely feels like the nervous system's being worked on, but I don't have a sense. beyond
Yeah.
that.
But it feels like it's more calming down right now, or does it feel like it's just locked in what it's doing?
I thought it was beginning to calm down, but it feels like it's still pretty active. It's not the prickliness, it's just pretty active.
And like internally, like emotionally, you feel good, you feel bad, you feel neutral? Like, what do you feel?
I feel good. In fact, after the first round, when you asked us, the word that came to me was pleasant. It's like, was calm, upbeat, but not excited. I don't feel agitated. I feel like I have.
Yeah, it makes me wonder if there's just a kind of a re-education happening. I kind of don't like that it's happening late at night when you're, needing to go to bed. But at the same time, I don't know that it's necessarily a bad thing.
Okay,
I would say let it ride out for about 15 or 20 minutes. And if you're not coming down, start using something like spikenard or kava kava or vetiver, even lavender, just to try to calm the system down, just so that you get a good night's sleep. I don't want to have a disruption of night of sleep, but could be that it's just rewiring your nervous system a little bit. I mean, that's actually kind of the goal of what we're doing. So.
I wondered, sleep's not been great the last 2 nights for whatever reason, but it hasn't felt quite like this. Thank you.
Okay, keep us posted. If you have a difficult night, email us in the morning.
And then Tracy, your hands up.
Hi, remember you had suggested that I use for my kid to clean my kidneys to do the sandalwood.
Mhm.
Well, I drink a lot of water, like I'm talking a lot, and I don't pee a lot. So can I take the Shazendra at the same time? I mean, not the same time, but while I'm taking it?
Yeah, I would actually wait a little bit on the Shazendra. Shazendra will definitely be in the mix, but I'd probably, you're not releasing a lot? Is that what's happening?
Not really, like it's not.
I would increase the sandalwood.
Okay.
Like,
I'm
what are you
taking-
doing? Just like a drop or two or what?
I'm taking 3 drops. Well, I was taking 4 drops and then I changed it to 3. So I know that's a lot. And I have a lot of inflammation and stuff. So I was just wondering if,
Like, when you say a lot of water, tell me, like, how much is a lot of water?
like 3.5 liter bottles a day. So what's that? 5 liters a day? That's a lot of water.
Are you thirsty?
Not remarkably more than usual. At first, I think when I take it, I'm probably a little bit more thirsty, but I can't really, it's negligible. And I did it for a week, and then I stopped for a few days. And then I just started back today.
Yeah, let's go ahead and have you do the Shazendra for like a couple of drops a day.
Okay.
Yeah.
And stop the sandalwood?
Let's have you stop the sandalwood and do Shazendra for like maybe just 3 or 4 days and then report
Okay.
back.
Thank you so much.
You're so welcome. Well, you guys, love you. I gotta step into another meeting, so really good questions and everything. We will continue next Tuesday, and so some of you I'll see tomorrow night, and some on the weekend for the chakra class. And if not, I'll see you next Tuesday. So
Thanks.
Love you.
Thank you,
take
Greg.
care.
Love
Love
you.
you guys.
Bye.
Take
Thank
care.
you so
Love you
much.
guys. Bye.
Thank you.